Dr. Bilski, the subject of the day, or of this video anyway, we're talking Invisalign.
Mm-hmm.
We can talk a little bit. My nephew has maybe a candidate for this, but I say maybe because it's mostly his upper teeth.
Mm-hmm. What's going on?
Well, just a little, can I say buck tooth?
So he has gaps too?
Yeah. Yeah, I mean, picket fence.
So we can eat corn through a picket
I mean,
fence?
can we just, yeah, okay. Are we allowed to say this? But yeah, I mean, it's, what the heck. It's,
yeah, we say that.
I bust on them, but that's...
family.
Is that something that Invisalign can help with? And
Yeah.
But do you have to get uppers, lowers? How does it...
So, yeah, a lot of times we get patients that come in and they'll say, Doc, I got all these spaces on my front teeth.
Yeah.
Can I just get some Invisalign? I'm like, sure. And I evaluate, and clearly it's, in the doctor's perspective, to do, it's called arch therapy. Ideally, you want to do upper and lower arches, upper and lower jaws, upper and lower teeth. So if you have spacing on the uppers,
Yeah.
and you have spacing on the lowers, that's like the easiest one to do. But you have to corral those lower teeth so the upper teeth can follow into place.
Gotcha, yeah.
You can't, I shouldn't say you can't. You can do almost anything, but the end result may not be what you want. And the therapy takes longer to complete, the clear aligners, the Invisalign therapies. So in order to expedite and be as efficient as you possibly can, you always want to incorporate the upper and lower teeth. You may have spacing on the lower that you want to correct. You still should strongly recommend we do the upper teeth at the same time.
Mm-hmm.
The actual mechanics behind it and how they develop it with the software, we scan your mouth with a camera. We don't do putty molds anymore. The computer does all of the measurements and then develops in a virtual presentation, like a video.
Yeah.
It shows you how your teeth have spacing, and then over, say, typically it's 12 to 14 aligners. That means every 2 weeks you change them. So it might be 24 to 28 weeks, 7 months. It's typical average. And you can see from day 1 or 0, crowded or spaced teeth, how those teeth manipulate and move with the upper and lower teeth together in a video.
Neat.
And then we can click off the bottom and just look at the top, and then click off the top and look at the bottom, and then put them together. We can spin everything around so it answers all of the questions and shows why we do the upper and lowers. If you have crowded teeth on the top and crowded teeth on the bottom, that's easy too. When it gets tough with the clear aligners is when you have spacing on the top and crowded on the bottom.
Oh, then it's a little bit of a challenge.
So now you're mixing things. So you really don't want to do single arch or only the tops or only the bottoms.
Right.
So the bottom line is, if you come to see me, we'll have that same discussion.
Yeah.
You're only extending your treatment to get to a point after 1 year that you're still unhappy.
Mm-hmm.
And we're going to do dual therapy now, which costs more. So why don't we just incorporate it in the beginning and know where we're going with this, upper and lower teeth together?
It's all about somebody getting a smile they like, and you're able to look and tell them this is what has to happen.
So could you imagine you're in my office and Randy, you need upper and lowers together. I don't want to do that, Doc. All right. So you just want to do the uppers, Randy? Yeah, I just want to do.
And then I'm back in a year, right?
And then I'm looking at you, like, Randy, I told you so. Or what if I didn't tell you? I just said, okay.
Yeah, right.
And then I'm having that backpedal conversation.
Yeah,
like,
right on.
Well, guess what, kid? It's going to cost you another couple $1,000s. Like, why, doctor? Well, you didn't tell me. So we like to be transparent. We just tell you right off the bat, like, look, upper lowers.
You're as transparent as the Invisalign themselves are.
Well, yeah, that's a good one. Maybe I should use that.
Yeah, go ahead.
So here's the other part of it too. There are some cases where you can just do single arch. So I don't want to always pigeonhole that everybody gets upper and lowers, because we also do what are called proposals to begin with. And in what's called a lab prescription, I would say patient requesting, or my professional opinion is, I think we can do single arch, alert me to anything that would suggest contrary. So I want single arch, you want single arch, but after the analysis, it's going to delay treatment, and then you're still going to have a discrepancy, meaning a problem, and then we're talking about this again. So that's nice about the technology.
Yeah. It really is. It's almost like telling the future a little bit with that.
Well,
you get to see what's going to happen.
So, like the two letters in the world now that you don't like to talk about is AI,
I was
right?
just going to say. I didn't bring that up. I didn't want to.
So, well, I'm going to bring
now
it up.
Dentistry, huh?
So here's the part which is confusing. It is AI generated, and the reason why we have AI generation is there are things that AI can do rapidly that it would take the eyes and the brain to look at. So the measurements in and of itself and the AI analysis can tell you how quickly and how things need to be done. And more specific to what the doc needs, it doesn't tell me how to do it.
It just gives you the information you need to make.
It just says, here it is. It looks like 14 aligners, 28 weeks. All right, perfect. And it does it like that. So we're not analyzing. Back in the day, when I first started, I used to dabble a little bit in the braces, wires and brackets, which we send to Dr. Sullivan now in Brecksville. But you'd measure every tooth and then you do the math and you calculate.
Did you have one of those little rulers in your pocket while you're doing it, the slide rulers and all that? That's back in the day.
I swear I'd never wear a pocket protector ever. So anyway, that's kind of.
Well, I can say this, Bilski Dent's come a long way since the pocket protector days, and it's good to see. So you've got all the stuff. So.
Yeah, we do. It's really remarkable. If you took all this fun stuff away from me, I think I'd be done.
No, we won't take it away.
So keep it coming there.
Thanks a lot for watching.